Cabinet has determined that the alert level for the whole country should be lowered from level 4 to level 3, with effect from the 1st of June 2020. This will result in the opening up of the economy and the removal of a number of restrictions on the movement of people, while significantly expanding and intensifying our public health interventions. Even as we move to alert level 3, it is important that we should be aware that there are a few parts of our country where the disease is concentrated and where infections continue to rise. We will have what we call a differentiated approach to deal with these areas that have far higher levels of infection and transmission. These areas will be declared coronavirus hotspots. A hotspot is defined as an area that has more than 5 infected people per 100,000 people, or where new infections are increasing at a very fast pace. The following metros in our country have been identified as coronavirus hotspots: Tshwane, Johannesburg, Ekurhuleni, eThekwini, Nelson Mandela Bay, Buffalo City, and Cape Town. There are other areas that are also hotspots, and they being West Coast, Overberg, and Cape Winelands district municipalities in the Western Cape, Chris Hani district in the Eastern Cape, and Ilembe district in KwaZulu-Natal. We are particularly concerned about the situation in the city of Cape Town and in the Western Cape generally, which now has more than half the total infections in the country. We are attending to this as a matter of urgency. The list of hotspot areas will be reviewed every 2 weeks, depending on the progression of the virus. In dealing with the virus in these areas, we will implement intensive interventions aimed at decreasing the number of new infections. We're putting in place enhanced measures of surveillance, infection control, and management. We will assign a full-time team of experienced personnel to each of these hotspots. This team will include epidemiologists, family practitioners, nurses, community health workers, public health experts, and emergency medical services, and these will be supported by the Cuban doctors who are experts. Should it be necessary, any part of the country could be returned to alert levels 4 or 5 if the spread of infection is not contained despite our interventions, and that where we see that there is a risk of our health facilities being overwhelmed. People will also be able, in this level 3, to be able to exercise at any time during the day, provided this is not done in groups. The curfew on the movement of people will be lifted. Alcohol will be sold for home consumption only under strict conditions on specified days and for limited hours. Announcements in this regard will be made once we have concluded discussions with the sector on the various conditions. The sale of tobacco products will remain prohibited in alert level 3 due to the health risks associated with smoking. Because of their vulnerability, all staff who are older than 60 years of age and those who suffer from underlying conditions such as heart disease, diabetes, chronic respiratory disease, and cancer should ideally stay at home.